listeners, well to see you. Welcome again this week on this special topic. Hmm? So, if you are busy right now, please drop what you're doing and watch this stress free. Let it penetrate your head. The talk for today, no, you worry. Not as until you must go for loss. Whether you be mommy, you be papa, you be young girl, you be young boy, the one concern you. What am I saying? What is the topic for today? It's abortion and pregnancy test. So you first need to know your status, whether you do belle or not do belle. I will talk to about abortion. Okay, let's get this right. Sometimes you don't make 1, 2, 3 days where the way their menses occur. You never see them. Your heart start cutting your belly. Oh. Something you start to touch your skin. You see something above it today don't flop. You start get small fever. Your heart cutting your belly. You don't run, pap. You go buy a pregnancy test. You go make a peace. Or you go for hospital, you go say me they do out with blood. I want to tell you something before you go shake your womb. Say one more belly, we don't know whether to treat your belly, we not do belly. Get this clearly. When you go to the hospital or to a roadside vendor to get a pregnancy strip to do a pregnancy test, I want to tell you that test where you go do am. None of tell you whether picking day for your belly. That test is not to tell you that there's a baby growing in your stomach. That test is to check a certain hormone in your body. When you do belly, for example, some hormone day for your body they call and say HCG, Human Gonadotropin hormone. The hormone day for all man in body. Time where you do belly or get some other problem. When you do belly you get some other problem. The hormone level the high, it climb for up. And when it climb for up, when you do test, it show and say positive. They need to look now whether picking day for the belly or not. They need to look now whether that hormone don't climb. So when you do a pregnancy test and it comes out positive, it does not mean you are pregnant. It simply means that the human chorionic gonadotropin hormone has increased above normal. And this increase can be due to pregnancy or another related problem. Now whether they say start clinic exactly when you know that you are pregnant. No shit over as some people used to talk. Non, on ne commence pas les visites maintenant et on commence mais quand on a 3 mois ou 6 mois de grossesse. We need to start cleaning now until maybe 3 or 6 months. No, mama. What thing they already happen now? Go start clinic or follow up exactly when you just realize and say you never see your menses or you don't do test, it come up positive. Go. And when you do, you find yourself in the hospital after doing a test and it comes out positive, there's always what we ask you to do, an echography. This echography is a confirmation for us to know whether true so na belle you dey or na different thing. There's what we call false positive. Sometimes you do a pregnancy test, you think you are pregnant, as I earlier said, whereas you are not pregnant. Let's get this. When you are pregnant and you do an echography, your doctor or your nurse will tell you after viewing the echography that you are pregnant. No na all belle they remove am. Abortion is illegal in Cameroon. That's a warning or a message to my Cameroonian followers. So others in other country it is legalized, but in Cameroon it's not legalized. I will give you some insights why many youths die today when they go in for an abortion. Most of these deaths are caused by you, doctors, you nurses, and some of you yourself, quarter doctors, asabi, abi don't fair do and afisti do. Listen, some of you when you do a pregnancy test, you have just gone to go and look for abortion pills. I'll not mention any abortion pills in this video for security and health reasons, and I'll talk a little bit about abortion pills. These abortion pills which some of you take, they are there to cause some contractions, stop some hormones from producing some substances so that it can empty the content of the uterus. Mommy, papa, brother, sister, if you suspect that your child is pregnant, your child has not seen their menses, the first thing, be calm. Calm yourself. Don't shout at that child. You may push that child to do something funny. Reassure the child that no, even lie at the point in time that this has once happened to you, whereas it was not even pregnancy. Go in for a test. And when you do the test, it's still positive. I know that anger now. Mama, first calm down. Calm down again. Struggle and do an echography until the echography tells you that that child is pregnant before you can talk, advise them. But don't jump into conclusion without an echography. And I will tell you reasons why some pregnancy tests are positive, whereas that person is not pregnant. One, a pregnancy test can be positive, but when you go for an echography, you realize that that patient or that person it's not pregnant because that person may have committed an abortion. The fetus has already been expelled. That's when you are coming for the test and going to do the echography. Oh, the test will be positive, but the echography will show that there is no fetus, there is no pregnancy. Because when you do an abortion, that HCG level, which was up when that person was pregnant, takes time to go back down and reach normal. So within that period, when you do a test, it will still be positive. So in quotes, maybe that your picking, that your child was pregnant and has done abortion already. Or there is another thing that can happen as such that will make your test to be positive, whereas you are not pregnant, which is that child can have problems with the ovaries. There beginning test visually be it shows a positivity, say the obele, we know the obele, because say he ovary them, they get small problem. And at times when that ovary they get problem, you get all signs and symptoms for belly. You get fever sometimes for morning, your belly, your body don't stand up. It's all start hot. You think say the flop now make. You start get small pain then so for underbelly. think say you do with belly, not na belly. And when you do test that time, it can be positive. I've had cases like that. Sometimes it can be also due to it can also be due to maybe an expired test strip. Sometimes that test wey the thing wey they use to make that test too don't expire. So not just see sometimes so not just see and say you don't do test, come up positive, you run maybe go shake your womb, say you want more belly, go cause your skin problem. And I go tell una something. And listen carefully. There are so many types of pregnancies. Even some of my colleagues, nurses, are not aware of this. Let's always take time. Let's take time when we are free. Read, upgrade, do research, so that we can meet to answer some of the questions that patients meet us in the hospital with. Listen. We get kind belly them, and these types of pregnancies, they are pregnancies and you are not even supposed to dare that you want to get rid of. And when you take an abortion pill, it go and cause you problem. Listen and listen carefully. First, let me talk about the two main types of pregnancies. We have what we call intrauterine pregnancy and extrauterine pregnancy. What did the intrauterine and the extrauterine pregnancy mean? When the pregnancy dey intrauterine, it means say that belly dey for correct place. It dey for place where it's supposed for be. It dey inside your womb. It go grow fine. When they say extrauterine, it means say it not dey for inside your womb. That time you go hear they say sometimes you get ectopic pregnancy. For big grammar, you hear some man say tubal pregnancy. Start confused. Oh, na one thing. Sometimes then you will get belly where the pikin not dey for, it not dey all for inside your womb, and it not dey for inside your tube. Part dey for inside tube, part dey for inside your womb. That time the doctor they go do you some good follow up so you born. In most cases that time na mostly operation, but God get as it dey. Sometimes the pikin go come out normally. And some belly they dey where instead of grow for inside womb or for inside tube, they can't grow for the abdominal cavity. Why they can't for the majority of people where they get belly where they grow for inside their abdominal cavity, and mostly people where they don't undergo cesarean section. That means they be tear their belly before they move picking. But it's rare though. And now una sabi waka go find pills, mixing them for go move belly. Someone they go take overdose for some particular medicine. Where I no go call am. So they want use am move belly. I want to tell una something. When you take these abortion pills, you obstruct your hormonal system. What I'm saying, get this well. When you take an abortion pill, you are obstructing or disrupting your hormonal system. You are indirectly inducing labor. That means the force for born where your time never reach. You move belly. Now your belly starts. That means you get cram them. You start bleed. At times you will bleed and bleed till death. The worst one at time where you take these pills, then you can meet up with small fibroid, small cyst for your skin. But cyst and fibroid fit be your skin where you don't know, because you never reach some level where you don't start hot. Why I dey talk this thing? I wan advise you. All pregnancy tests wey come up positive no mean say you dey with belle. No go shake your womb o. No go dey shake your womb say you wan move belle wey belle no dey. Na you go hear bad Gonadotropin. Where you die, na you die, na you die. Abeg before you wan think for die, try remember kati wey you go leave am. It's very important. So man, if you don't even lost chop because say you wan go move your. My advice to my fellow colleagues in the field, I beg you, I taking God's name to beg you. I'm buying this vision from my former employer, Unite for Health Foundation, who's 100% against abortion. Let's stop abortion. We are endangering lives. Many of you go further giving abortion pills without knowing the aftermaths. And when the aftermaths come, you don't even know how you can do to arrest the situation. That time you start packing your luggages to leave the town that you are. So let's join together and say no to abortion. I think that this topic I've tried to even tell you why sometimes you feel like you're pregnant, you go and do a test, it's positive, whereas you are not pregnant. Don't forget to click the like button. Don't forget to subscribe, notification button for future videos. I'm on Facebook as Nesbertus Igbo, the same name I use on TikTok for my crazy videos. It's your celebrity Nes. Thank you. Ciao, ciao.